Hello friends, today I will give you that brief idea for the getting of awareness purpose. The coronavirus or COVID-19 in that modes of transmission, the part 2. So here, what are the basic information based on that? This information, the basic information, the based upon the availability of the evidences, the publications and WHO. So further studies also needed, further information, upcoming information also needed. In the research field, there is no any ending of the whatever the information to any kind of the diseases or whatever matter. It is a continuous process. It is a continuous process. We need to update the latest informations as per my possibilities, whatever I have the possibilities based. I am giving some basic information to creating the awareness for that purpose. So here in the part 2, especially this will be related to in the medical experts, medical related areas, and here the airborne transmission may be possible. Through the airborne transmission may be possible. So what are the conditions here? These conditions are very, very important as per those guidelines and evidences and publications as on date, and further many more publications also they will be revealing, but at the same time, so we need to update some of the knowledge. That is the main intention here. So here, in specific circumstances and settings in which procedures or support to treatments that generate aerosols are performed. So this is the condition. So what are those conditions? Whatever the possibilities condition performing time by the medical experts and hospitals. These are the pulmonology department experts and some few more doctors related to these areas, respiratory disorders areas. While performing time of those experts, within these basic information of that 10 kinds of procedures, settings, times, some of the aerosols production or chances are there, spreading chances are there. So here what is the meaning of the aerosols? That is the suspension of fine solid particles or liquid droplets in air or another gas. So that is the main basic information, basic meaning of the aerosol. So while performing time, those experts within these areas, maximum possibilities areas, so the aerosols performing chances are there as per those evidences. So number one is endotracheal intubation performing time, the doctors to the patient, respiratory disorders patient or infected patients performing this endotracheal intubation time. So in this time also aerosols production possibilities is there. So we cannot see with the eyes. So that's the main problem here. That is very minute particles. So what are the causing agents of the coronavirus particles are very minute. You cannot see with the eyes. So that's the endotracheal intubation time. So the tube will be placing either through mouth or nose towards the windpipe, another name is the tracheo, and that will, what is the main purpose of this one? To permit the air to pass freely to and from the lungs in order to ventilate the lungs. All these procedures, the experts, the medical experts, they are performing their level best to save the patient. So at the time they are using these areas of the surgical procedures. At the time also some of the chances are there. Some of the chances may be there to providing or to produce whatever the generating of the aerosols. And then second area, second procedure or whatever the settings in which the procedure support to the treatment time to the patients by the experts, medical experts. Then bronchoscopy. So here in this condition also, so this will be, what is the use of this? That will be examined inside lungs including bronchi. So while performing time, the medical experts, the pulmonologist to the patient, so this bronchoscopy performing time also, the production chances also there. And next to third category, the open suctioning. At the time, what happening here? Using single-use catheters inserted via the open end of the tracheostomy tube. So this condition obviously in this type of procedure. So here catheters means generally inserted in the body to treat diseases or perform a surgical procedures. At the time they are using different kinds of catheters. So this will be the basic information to provide some awareness how those aerosols may be chances to provide. So fourth procedure, administration of nebulized treatment time. So generally that procedure following that experts whenever the patient unable to take the medicines, so that liquid medicine that will be turns into mist, and that mist is nothing but small droplets type it will be inserting into the body, especially in the pulmonology areas, that is the lungs areas. And manual ventilation before intubation, so that performing time also. So here what happening, that ventilation, what is the main purpose of that? It is a basic skill that involves airway assessment. So that is nothing but effective positive pressure ventilation providing purpose. That's a ventilation in this area procedure. So here the intubation means insertion of an artificial ventilation tube where into the trachea at the performing time also. So they need to take care of all these procedures performing time, the medical experts. So the protective PPEs must be they use. That's a very, very important, and very more precautions also they should be take care of to prevent the spreading of these aerosols and whatever the generating chances. And sixth one, turning the patient to the prone position. So generally whatever that surgery during time, the patient lies face down for access to the posterior head, neck and spine. During spinal surgery times they will be shifting towards the prone position, the patient by the experts. And seventh one, disconnecting the patient from the ventilator. Whenever after finishing the treatment, so they will be disconnected. At the time also some of the chances are there. The ventilator is nothing but it is a machine. So that is the mechanical ventilation that will be provide the artificially the air towards the lungs. That purpose that ventilation will be useful. And next that eighth one, non-invasive positive pressure ventilation. So here what is happening? The delivery of mechanical ventilation to the patient with respiratory failure without requirement of an artificial airway. So at the time the non-invasive positive pressure procedure or ventilation they are using. The ninth one, tracheostomy. So generally this procedure or surgery time, small surgery, the opening of the neck below the vocal cord area. So for air allowing to the lungs purpose, to the place the tube into a person wide pipes. For that procedure performing time also, some of the chances are there to provide the aerosols or to generate the aerosols performing time in this that particular area of the hospitals. And next that 10th one, cardiopulmonary resuscitation. So in this what happening, this will be generally cardiac arrest time they will be performing this condition. So that is the emergency procedure, that compression often with artificial ventilation, so that preserve intact brain function until further restore spontaneous blood circulation and breathing in a person. So whatever these are the procedures or circumstances or settings performing time by the experts to save the patient, whatever the respiratory related diseases suffering patient to saving purpose times. So they are using, these are the common basic procedures. So at the time also the generating of the aerosols chances are there as per those evidences. Thank you very much.